Hello, my name is Yvonne Fokum Takoeta, and this is my presentation on diabetes, self-management of chronic diseases in mentally ill inmates with diabetes. Stakeholders and each group's role. While implementing the project, stakeholders such as pharmacy benefit managers and disease vendors may provide their active assistance. A pharmacy benefit manager, often known as a PBM, is an independent administrator of a prescription drug program who is mainly in charge of the processing and payment claims related to prescription drugs. In addition, they often negotiate discounts and rebates with pharmaceutical companies, enter into contracts with pharmacies, and create and manage prescription formularies. Almost 80% of the market for prescription drug in the United States is controlled by three prominent pharmacy benefit managers: CVS, Caremark, and a branch of United Healthcare. For instance, in 2021, CVS Caremark was in the lead, holding 34% of the total adjusted claims. The wellness biometric vendor is an additional key participant in the execution of the project. In context, a compilation of vital physiological information is called biometric screening. In a screening of this kind, the human body mass index, BMI, blood pressure, cholesterol, and blood sugar levels are often measured. Therefore, the goal is to supply the patient with information that may shed light on potential risk factors for various persistent disorders. Patients are being encouraged by disease management vendors in other areas to take their medicines as prescribed, understand better, and monitor their symptoms, and perhaps modify the behaviors contributing to their condition. Also, diabetes management vendors, also known as DMVs, provide their customers with various tools and methods that may assist them in managing a variety of ailments, including diabetes, high blood pressure, musculoskeletal disorders, and others. With individualized programs, coaching, and support, each provider assists businesses in their quest to improve the health outcomes of their workforce. Lastly, community organizations such as outlying medical clinics and fitness centers can provide significant assistance to the actual execution of the initiative. For instance, the members of the group can provide support to one another. People cooperate to accomplish collective objectives by sharing their talents and resources. Theoretical foundation and conceptual framework. Those who have type 2 diabetes may participate in a group program called the Diabetes Self-Management Program, DSMP, which lasts for 6 weeks. Researchers at Stanford University designed the program to assist people with diabetes in managing their symptoms, including exhaustion, discomfort, and emotional difficulties, by teaching them how to control their diabetes better daily. In context, this participatory session takes place every week for 2.5 hours at a different location in the neighborhood. Furthermore, it is presented by 2 trained leaders with diabetes. Exercise to maintain and enhance strength and endurance, and a good diet may be discussed as potential subjects of conversation. The conceptual framework comprises 7 interrelated vital components that comprises the model. These components include socio-demographic characteristics such as age, gender, and educational level, behavioral and psychological characteristics such as blood sugar monitoring, diabetes, adherence, and physical activity, and social support such as from family and friends. Concisely, the selected theoretical concept significantly addresses patient factors to chronic disease healthcare access, including health determinants and cultural and religious barriers. Such factors include cognitive unawareness, inadequate social support, and stigma associated with accessing healthcare for mentally ill diabetic inmates. Also, the program overreaching objectives are to improve clinical outcome, health status, and quality of life, and encourage decision making based on accurate information and behaviors related to self-care. Educational needs. Diabetes Self-Management Education and Support, or DSMES, is a significant educational need for all groups. The toolkit is a foundation built on research and assists individuals with diabetes in making choices and doing activities related to their self-management. For instance, recent research substantiates DSMES as an effective tool to enhance the health habits and outcomes of those with diabetes. Furthermore, incarcerated and mentally challenged inmates diagnosed with diabetes should know how to lower their intake of fat, sugar, and foods that have not been processed. Individuals with diabetes who are incarcerated should receive medical attention up to national standards. To meet all of these care criteria, correctional facilities have particular circumstances that must be considered. At correctional institutions, there should be established rules and procedures for the management of diabetes, as well as for the training of both medical and correctional personnel. To guarantee that all required level of care are provided, these rules need to consider concerns such as safety requirements. In an ideal world, these rules should encourage patients to self-manage their diabetes, or at the very least, allow them to do so. Therefore, the successful treatment of diabetes rests on having access to the appropriate medical staff and equipment. Continuous care of diabetes is essential for lowering risk of diabetes-related problems in later life, such as cardiovascular events, loss of eyesight, renal failure, and the need for an amputation. Also, the approach is likely to lower the short-term risk of acute problems necessitating evacuation outside the institution in persons with diabetes if early detected and intervention are performed on such individuals. Thus, adhering to the outlined educational need will result in safety improvement. Plan for implementation. Free participation in the session is offered to those inmates who are mentally ill and who also have diabetes or other chronic diseases. The workshop contains anywhere from 12 to 16 participants and are guided by 2 lay trainers, either one or both who have diabetes or other chronic health condition. Also, the trainers use a highly extensive guidebook as their guide. In addition to the several action plans that will be discussed, some of the subjects that will be addressed include ways to cope with symptoms of chronic diseases such as tiredness, pain, depression, stress, and healthy nutrition. Each participant should develop weekly action plans, discuss their previous experience, and collaborate to resolve issues while developing and executing their self management program. Furthermore, reviewing the material submitted by program participants should be a priority for stakeholders participating in program. Participants' self-assurance in their capacity to manage their health and keep an active and satisfying life is bolstered when they get support from one another and experience success. However, the program does not interfere with any therapy or other initiatives already in place. In context, the courses are designed to supplement those provided via certified programs. Such similar programs are often carried out at a healthcare facility. The therapy is maintained in its current form. Thank you so much for watching and listening to me. Any questions?